Hello everyone, and welcome to our video on euthanasia. We have got a special guest with us today. Would you like to introduce yourself? Tell us a bit about yourself, what church you go to and what you do.
So my name's Reverend Dr. Gareth Sherwood, which sounds terrible, but it's quite a formal series of titles, and it gives it away. I'm a trained medical doctor, but I'm currently a pastor down in Bournemouth. I'm also the chief executive of the YMCA for the region, and I'm currently working in a number of different areas of community life.
Wow, you sound busy, very busy. But that's good. Okay, awesome. So we're going to crack on with the first question. So firstly, what are your personal thoughts on euthanasia as a Christian?
So from a Christian perspective, the primary focus in euthanasia is not necessarily the do not kill, it's the value and significance of human life.
Okay.
And so the priorities as a Christian, the reasons for all of our ethical framework are down to the value of people and the oughtness or the rightness of treating people. And so there is a moral obligation to live your life, to honour people, to serve them, and to preserve their life and their dignity. And that brings euthanasia into a level of conflict, because on the one side of euthanasia, you've got the preservation of dignity, and on the other side of euthanasia, you've got the preservation of life itself. And so as a Christian, for me, I fall on the side of against euthanasia for a number of reasons. But throughout my Christian walk, I've certainly been raised a lot of questions due to life circumstances, living and practicing as a doctor.
Yeah, I can imagine. I can imagine. Now, I know it's quite a sensitive topic, but also a very, very tricky topic overall. And therefore, I think it's quite understandable that there's a split views on euthanasia amongst Christians. So why do you think there is that split in views of, for Christianity? Why do you think some people are for it and some people are against it?
I think it comes down to some Christians falling on the side of mercy and dignity and seeing euthanasia. Euthanos is Greek, it means good death. They see euthanasia as a route for keeping somebody's dignity in the last moments of their life, and a merciful act in the last moments of their life to effectively end their suffering. Whereas other Christians, you'll probably find, will hinge on the preservation of life aspect and say it's nobody's responsibility to make this decision, that's up to God himself. And so that's where some Christians would fall on one side or the other. I believe the statistics are in the Church of England, and I'm not part of the Church of England. I believe the statistics are that 70% of the average member of a Church of England church would prefer euthanasia. Okay. And about 30% would say.
Oh, that's interesting. Okay. You wouldn't really expect that statistic, to be fair. So that's quite interesting to know. Now, you said in your first question that there have been questions raised in your walk in Christianity. So I'm assuming you haven't always thought what you've thought on euthanasia, or you have, but could you tell me if there's been a process of up and down or fluctuating with your views on what you think about euthanasia?
So, as you grow up in church, and I grew up in church, you get told what the right things are. There's this sense of this is what the Bible says. You're supposed to think like this, and then you start to, as you go through your adolescent years, you start questioning, well, why? Most kids ask the question why. And as you dig deeper into understanding what whys mean and the consequences of that, you start to question and challenge some of the interpretations of Bible and scriptures that other people have given you that you grew up with as a child. Right. And so that whole process goes through. And then during that, for me, through those adolescent years, while I was trying to understand, well, why does it say don't kill? Why does it say don't murder? Why does it? You come to the conclusion about significance, value of life. And then as you go into medicine, for me, I had encounters with, suffering that I had not seen before, death, the relief of suffering, coming alongside patients who are terminally ill, managing the families, hearing people say things like, why didn't you just kill me? But also hearing and seeing the stories of relatives that decided that their life is no longer worth living because the family members have said it would be better if they just died.
Yeah.
You know, and seeing people go through heart-wrenching situations, it challenges your framework of the way we should see this and the way we should react to this.
Yeah, no, I can imagine.
I have a lot of sympathy with some cases.
Say that again, sorry.
I have a lot of sympathy with some cases where suffering is extremely difficult to relieve.
Yeah.
But I mean, I don't know if you want to dig into it right now, but there are reasons why I've fallen on the side that I have. I mean, simply put, the euthanasia debate can be brought into three main categories. One is that people think we need it. One people think we want it. And finally, the final thing is people think we can control it. And so when you look at the reasons for euthanasia, it usually falls into those three categories. And then the arguments against it usually are, we don't need it, we don't want it, and we can't control it.
Right, yeah.
And so from the Christian perspective, and this is where it's slightly unique, we come at it from a sanctity of life, significance of life, and more importantly, the way we measure the worthwhileness or the significance of life. Because without God in the framework, let's move him out of the screen, so he's over there. There's no soul, there's no spirit, there's no statement that says everybody's made in the image of God. So therefore there's no value of human life,
of course,
that I can't measure.
Yes.
There is only the value of human life that we can measure, which usually bottles down to what the body does and what the body looks like.
Right.
So with euthanasia, it's somebody's life is no longer worth living because they've lost the ability to take themselves to the toilet, they can't move anymore, they can't speak anymore, they're losing faculties, they've become dementia, they've had a severe stroke, their life is no longer worth living, it must be intolerable to live like that. And if those people are expressing that opinion, saying my life is no worth living, we have sympathy because we agree with them.
Yes. Yeah.
Or we have sympathy because we understand that they're in the full faculties of their own mind. But really, to understand whether somebody's in the full faculties of their own mind, they must be making a reasonable decision. And so we find agreement with it. So, but as a Christian, I don't measure the worthwhileness of somebody's life according to a series of categories of what their body looks like or what their body does. That's what gives me anti-slavery, because I don't value people's worth or significance on the basis of what they can do or what they look like.
I see.
And human equality is on the basis of we measure all life, yours, mine, somebody who's disabled, somebody who's able, somebody who has different color skins, different genders, whatever it may be. You have the same significance, not because of a list of what makes your life worth something, but because, let's bring God back into it, in our culture and society, we say all men are created equal. Right. So from a Christian perspective, because we don't measure human life according to a series of categories of whether it's worthwhile or not, I can't step into euthanasia without losing that principle. And so for me as a Christian and as a doctor, I would argue that if we open the door of saying, well, somebody's life is less worth living if this, we actually open the door to wide-scale inequality in our culture because we've changed the way we view humanity itself.
Wow, that is very interesting. Very interesting perspective. And very deep. No, I get that. So the big difference, which essentially might seem obvious, is putting God into the equation and how we value or how we see human life. So yeah, you've mentioned that you're a doctor, and this goes nicely on to the next question, which you already have touched on. So I was going to ask if you've come across this, but you just said you have. So in your experience as a doctor, the cases that you've come across where euthanasia would have been appropriate, is there any example of an actual experience that you've had where that's come up and the person has miraculously had a full recovery, after the family making the decision or possibly making the decision to maybe stop giving them food or water? What could you give us a actual example of maybe something that you've experienced yourself?
Yeah, so I mean, I've seen a guy come in with severe pneumonia on the back of smoking problems with the lungs, and so his breathing effort was a twitch of the head. He couldn't discernibly see like he was breathing. He was blue. We did everything for him as medics. We put him on the oxygen. We gave him the drugs that you need to give. And he wasn't suitable to go to intensive care because of his long-standing issues. So we'd done everything we could. And yeah, he was dying. It was a no-brainer. The doctors around me were all like, let's just give the family time, put the curtains around, and just give him time. He's not got long to last. Wow. And I remember 2 hours later, my registrar turned around to me and say, what happened with that guy? And so, I don't know, curtains are still closed, the family is still with him. So I opened the curtains, and there's the guy sipping a cup of tea, chatting away to his family. And I just think, what the heck?
Oh, wow.
So I used to say we're rotten guesses. But I think where it's important to talk about sickness and illness is euthanasia on the front end is usually terminally ill, suffering unbearably. So terminally ill, less than 3 months to live, suffering unbearably. What is suffering? Persistent hiccups, pain, incontinence, not able to control your poop, all of that sort of stuff. Is that suffering? What about mental torture? Is that suffering? So there's the whole bracket of what is suffering, which is a whole. But suffering unbearably, terminally ill. What about somebody who's suffering for 20 years and is not terminally ill? Shouldn't they be given the choice? Why is it that just because they're dying, we can accelerate it, but if they're not dying, then we can't? Surely 3 months of pain is better, and death is a mercy, than 20 years of pain. And so why stop there? And so slippery slope is where these things are rattling. What is suffering? You can't tell me I'm in pain. I'm the one that tells you I'm in pain. So my definitions of suffering can be, persistent hiccups. Some people suffer with hiccups for years. Is that suffering unbearably? Well, to the person, it might be. So this process moves on. And so for me in medicine, 2 cases I can give you straight off the bat. I had a lady who had dementia, and she had a severe stroke, and she had no family members around her. And she was unconscious. She was elderly, she had dementia, and she had a very severe stroke that rendered her unconscious. So my consultant at the time decided that he was not going to give her fluids, but he was just going to let her pass. And she died over a period of 7 days of dehydration.
Wow.
And I watched her die. And the consultant kept saying, no, we're not giving her anything. No, we're not going to give her anything. Now, whether that consultant effectively did passive euthanasia or active euthanasia is up for the debate. Did they just load the gun and give it to the patient, and or did they fire it themselves? Did they make the decision for the patient? Certainly, the patient made no choice, so it wasn't voluntary. So there's this whole question. The other case that would spark debate for you guys was the case of a lady who was in a side room. She had a stroke, and but she didn't have dementia. She was in her full faculties, but it was quite a severe stroke. She couldn't swallow for herself.
Wow.
So she needed feeding through tubes. And on the outside of the corridor, outside the side room, the family were discussing her life. And the comment was made between 2 of the children, wouldn't it have been better if this had just taken her? Her life is gone now. And inside the room, the mother overheard it.
Wow.
And from that moment, she refused all treatment and died within the space of a month. She died of starvation because she refused the tube to feed her. She just died within the space of a month. So the question is, who decides? If it's that person that's decided she wants to end her life, on what basis has she made that decision? So we need it. 96% of palliative care consultants who specialize in terminal care of patients say we do not need euthanasia. We do not need to kill the patient to kill the pain. 96% of doctors that work in this specialty don't want it. So we need it is a good question. We want it. Who wants it?
Right.
Economically, euthanasia is better for the country than if we did end-of-life care. 60% of all end-of-life care in this country is done by charity, not by the NHS. So it's not even funded properly.
Right.
We want it. We want it on the basis of what? Bad evidence? And we can control it? Well, there's so many examples of the loss of control of euthanasia through many countries that have brought this in, that I think this step decision point to start choosing to make life worthwhile on the basis of a list of things that make life worthwhile versus an equality of life framework. For me as a Christian, that's why I stay on this side, because it's too complex and a door we just do not want to open.
Right.
To kind of let euthanasia in. It's far better to do end-of-life care well than to just choose to give up and end the life itself.
I see, yeah. Wow, you've given us very, very interesting points to think about. And to be honest, you've given good points for a debate as well, for and against. So I appreciate that. We are going to go on to the last thing, which is a statement. And I just simply want you to say whether you agree or disagree, even though I think we already know the answer. But the statement is, in the Bible, it says, and this could come from an argument from a Christian, of course, it says, "You shall not murder," in the Bible text from the Holy Book for Christians, which is Exodus 20, verse 13. Therefore, because it says you shall not murder, euthanasia should not be allowed. Do you agree or disagree?
Sort of. The reason why it says do not murder is it's basically saying do not intentionally bring about the death of another person.
Yeah.
And euthanasia is an act of intentionally bringing about the death of another person. And so in that sense, we shouldn't. There are always caveats. So even in the Bible, it says do not kill, and yet God tells people to go to war. So So do not murder. It is the intentional bringing about the death of another. And I think in the case of euthanasia, the application of that is because God doesn't want us to be the ones that decide which life is worthwhile and which even our own. And that's why I'd agree with it. Does that make sense?
Yes. No, yeah. Thank you for your answer. It's very clear. Thank you again, Pastor Dr. Gareth Sherwood. Thank you very much for joining us. And hopefully you guys have enjoyed watching our video.
Pleasure to meet you. Pleasure to see you all.